Hello and greetings. My name is Barack Owino from the African Alliance, supporting partnerships, advocacy, and campaigns, as well as coordinating People's Vaccine Alliance Africa activities and campaigns. Today, I'm going to present on the reflection on the movement for a People's Vaccine, talking about the co-creation process for the strategy guiding the People's Vaccine Alliance. So the PVA is a global movement of organization, activists, former heads of states, Nobel laureates who came together back in 2021 to lobby and advocate for a people's vaccine, especially for the COVID-19 vaccine. There was need for the People's Vaccine Alliance to recreate the strategy guiding its activities for the next 1 year. And we had the PVA regions working through in a co-creation process, and Africa was represented with brainstorming sessions by the CSOs. Out of this, 61 CSOs were engaged in this and identified common priority areas, which included health system strengthening. So they need to build health system that cares for all people, then equity in access to COVID-19 tools for communities, especially in the global south, and urgent amplification of marginalized groups in the COVID-19 response, mostly through pandemic preparedness and response. Out of this co-creation process, the next steps will include a similar process to inform the People's Vaccine Alliance Africa strategy, which will be created to guide the activities of the Alliance within the next 1 year. Thank you so much, and reach out to us for any follow-up questions.
Hello, good day, everybody. We conducted this web-based cross-sectional study among parents having at least one child less than 12 years of age in the Al Jauf region of Saudi Arabia. An exponential, non-discriminative snowball sampling was used to recruit study participants. Data were collected using a pre-validated, self-completed electronic questionnaire, which was in Arabic language. All data were entered and analyzed using appropriate statistics in the SPSS. A total of 444 parents were included in the analysis. Mean age of the study participants was 28.4 years. Around 91% reported that they were fully vaccinated against COVID-19. 56% reported that the healthcare decisions for the children were made mutually. Regarding parents' intention to vaccinate their children for COVID-19, we found out that 42% of parents showed intention to vaccinate their children for COVID-19. Moreover, around 74% stated they would only consider COVID vaccination for their kids if it was made compulsory by the government. Major barriers associated with COVID-19 vaccination uptake in children was concerns about the safety of COVID-19 vaccines in children, followed by parental doubts on COVID-19 vaccines efficacy. In conclusion, our findings indicated significant parental hesitancy towards COVID-19 vaccination in children. Health regulators should focus on addressing parental concerns about COVID-19 vaccines, safety, and efficacy in children. Moreover, they should also ensure parents have good understanding of the importance of vaccination so that parental vaccine hesitancy can be tackled effectively. Thank you.
Good day, I'm Dr. Yusra Habib Khan, and the topic I'm going to present today is barriers and facilitators of childhood COVID-19 vaccination among parents, a systematic review. As we all know, the coronavirus pandemic has caused a serious disruption in the healthcare system with the emergence of new variants of the virus and a dire need of achievement of herd immunity. This is the time that we want to vaccinate our population as early as possible. As children compose a major portion of the world population, it is extremely important to vaccinate our kids. With respect to vaccination of kids, the vaccine hesitancy is a global concern as indicated by WHO. The purpose of the current review is to summarize the information, this diverse information of vaccine hesitancy, as there are number of factors that are associated with vaccine hesitancy, number one. And secondly, the rate of vaccine hesitancy is disturbingly high in certain areas of the world. So our review purpose is to summarize the information into a composite document that might help healthcare professionals and policy makers to concern the address accordingly. I will focus on the methodology now. The following, we have followed the PRISMA guidelines and we have used different predefined databases. By using predefined search, we have identified 108 studies that focus mainly on the parental concerns regarding childhood COVID-19 vaccination. We have divided our results into three main parts: vaccine hesitancy rate, facilitators of vaccine acceptance, and barriers towards COVID-19 vaccination. I will start with the vaccine hesitancy rate. There was a wide variation. The maximum vaccine hesitancy was observed in Turkey in a study where 90% of the parents were reluctant, whereas less than 1% parents in South Africa reported vaccine hesitancy. The wide variation can be explained. Maybe it is one of the factors that African countries are very much prone to communicable diseases and they are likely to accept vaccination provided it is available to them free of cost. The barriers towards vaccine hesitancy in our review, out of 108 studies, we have enlisted four main barriers. Number one is the low education status of the mother, parent, and especially mother, because in most cases, mothers were responsible for taking healthcare decisions of the kid. Number two, financial constraints. Number three, low trust in the vaccine, because vaccines were developed at a very fast rate. So people were thinking that this should take time. There are no long-term studies that will show the effect of vaccine in children when they grow up after like 3 to 5 years. And lastly, unmonitored social media activities. There were so many rumors about vaccine, and that have significantly affected parents' belief towards vaccination, especially those with low education level. Similarly, with the facilitators of vaccine uptake, we have enlisted three major factors. Number one is a higher education level of the parents. The more they are educated, the more they are willing to vaccinate their kids. Number two, if they obtain this information by the healthcare professionals, if they are in direct contact with the healthcare professionals, especially parents of children with chronic diseases like cancer or autoimmune disorders. Number three is the strong belief in the government, that their government is doing their best with regards to the preventive measures or with regards to the facilities that are given to control the pandemic. So, in conclusion, current review underscores that parents around the globe are hesitant to vaccinate their kids, and there is a spectrum of factors that is responsible for this hesitation. Identification of these factors will help us to make policies and to help us to implement such policies in the target audience. Thank you so much. With this, I'm done.
Aims of Frederick Committee from Kenya Medical Research Institute with a background in diploma, clinical medicine and surgery, and BSc Public Health, equally extensive knowledge and experience in conduct and management of clinical trial. I will present an abstract on community members' perceptions of COVID-19 vaccination mandate in Western Kenya. Vaccination mandate is aimed at improving the vaccine through curbing the vaccine hesitancy. In Kenya, the vaccination mandate was declared in November 2021. However, there were concerns among the community members that hindered the vaccine uptake. This paper, therefore, described the community members' perception on the vaccine mandate and through understanding the perceived impediments and the perceived benefits of the vaccination policy and mandate. The methods that were employed were exploratory research design through conducting 28 focus discussions with the community members. A purposive sampling was done to select and collect information and opinions from the community members, who included the opinion leaders, community health volunteers, women of reproductive age, and head of the household. A trained moderator and a note taker led the discussion using an open-ended interview guide. The discussions were in English, Kiswahili, or Luo and were audio taped. The data was transcribed and analyzed thematically using Vivo 12. The study area was in Siaya and Kisumu County, respectively, in Western Kenya. The result demonstrated two dimensions of opinions of vaccination mandate, i.e. perceived benefits and the perceived barriers. For the perceived benefits, the community members shared that the mandate enabled easy access and availability of the vaccine, as the government was determined to reach large numbers of population with the vaccination services. For the perceived impediment, the community members shared that there was less information about vaccine safety, which was coupled with the lack of clear policies and structures to manage side effects, violations of individual liberty and autonomy to choose and make decisions. In conclusion, vaccination mandate was a good idea that improved vaccine access and availability. However, there is need for the policymakers to have a community engagement and get clear insights of the community members. I want to acknowledge the contributions from the study participants and the collaboration between KEMRI LSTM and CDC, study staffs of KEMRI LSTM, and also Ministry of Health through the Department of the County Government, Department of Health of both Siaya and Kisumu County. Thank you.
Hello and greetings. My name is Barack Owino from the African Alliance, supporting partnerships, advocacy, and campaigns, as well as coordinating People's Vaccine Alliance Africa activities and campaigns. Today, I'm going to present on the reflection on the movement for a people's vaccine, talking about the co-creation process for the strategy guiding the People's Vaccine Alliance. So the PVA is a global movement of organization, activists, former heads of states, Nobel laureates who came together back in 2021 to lobby and advocate for a people's vaccine, especially for the COVID-19 vaccine. There was need for the People's Vaccine Alliance to recreate the strategy guiding its activities for the next 1 year. And we had the PVA regions working through in a co-creation process, and Africa was represented with brainstorming sessions by the CSOs. Out of this, 61 CSOs were engaged in this and identified common priority areas, which included health system strengthening. So they need to build health system that cares for all people, then equity in access to COVID-19 tools for communities, especially in the global south, and urgent amplification of marginalized groups in the COVID-19 response, mostly through pandemic preparedness and response. Out of this co-creation process, the next steps will include a similar process to inform the People's Vaccine Alliance Africa strategy, which will be created to guide the activities of the Alliance within the next 1 year. Thank you so much, and reach out to us for any follow-up questions.
Hello, my name is Vanessa. CDC has defined vaccine hesitancy as the refusal or the reluctance to vaccinate despite the availability of the vaccine. In addition to other preventative measures, COVID-19 vaccines are instrumental in curbing the further spread of SARS-CoV-2 infection. Like many countries, Namibia has also reported a low uptake of COVID-19 vaccines. This is justified by a report by the government that indicated that only about 28% of the population received full vaccination, and about 32% of the population received at least one dose of the vaccines. So our study is aimed at understanding the factors that contribute to vaccine refusal and vaccine acceptance in communities within the country. This will then help us to come up with targeted or specific and targeted interventions to improve vaccine uptake within the country. This arm of the study, we collected qualitative data through semi-structured interviews, and the study setting was 3 rural communities in the Omaheke region, the eastern part of the country. The preliminary data that we found, out of the 22 enrolled participants, about 31 of the participants indicated that they are not vaccinated and or are not willing to vaccinate, while the remainder of the participants indicated that they were vaccinated. A considerable amount of the reasons why the participants did not vaccinate was due to negative attitudes towards the vaccine and misinformation about the vaccines, and also concern about the safety of the vaccine. While the reasons given for vaccine acceptance is because of fear of dying, as participants lost loved ones, and others have indicated that they took the vaccines because of employment opportunities. So at this stage, we can conclude that the reasons for vaccine hesitancy or reluctance is due to misinformation and lack of information and concerns around the safety of the vaccines. Thank you for the opportunity.
Hi, I'm Dr. Tokir Hussain, working as Assistant Professor in Department of Clinical Pharmacy, Jof University, Saudi Arabia. I am here to present my research findings related to the topic about side effects of COVID-19 vaccines among the chronic patients in Saudi Arabia. As we know that the vaccine hesitancy is comparatively high among people living with one or more comorbid conditions. So people with chronic conditions, they usually hesitate to receive vaccines, and this hesitation is primarily due to the fear of side effects. So in this context, it is very important to inform this population about the safety profile of the COVID-19 vaccines. So this study was planned to determine the safety profile of COVID-19 vaccines among the disease patients. And we have collected the data from Saudi Arabia, and we included 204 patients with at least one comorbid condition in this study. We found that 24 side effects were reported after the first dose, and 22 side effects were reported after the second dose. The incidence of at least one side effect was 88% after the first dose and 95% after the second dose. The most common side effects after the first and second dose were pain at injection site, fatigue, fever, muscle and joint pain, and stress, as well as headache. The average side effect score was 4 after the both doses. It means that on an average, the number of side effects were 4 after first and second dose. We found that female gender and some comorbid conditions like hypertension, diabetes mellitus, and hyperlipidemia, and the number of comorbidities and the family history of the COVID-19, and most importantly, the use of AstraZeneca vaccine were significantly associated with high side effect scores. So what is the conclusion of the study? This study showed that side effects of COVID-19 vaccines are short-lived and transient among people having chronic diseases. So side effect profile is comparable to the safety reports of phase 3 clinical trials. So it means that COVID-19 vaccines are safe among people living with chronic conditions. The findings of this study will boost the confidence of this population on the vaccines and will help to overcome the vaccine hesitancy. And ultimately, our study will help to increase the vaccine coverage. Thank you very much. If you have any question, then you can ask me or you can contact me. Thank you very much.